Hi, and welcome back to Unmasking the Trans Movement with Jon K. I'm your host, Brad Wilder. Today we're going to discuss a deep topic that goes into transgender politics versus brain science. With us on the show, Jon K, as well as Dr. Ann Gillies, and a special guest, Dr. Michelle Cretella out of the USA. We'll be back with more right after this.
Do you notice a change in your child? Do you wonder what's going on with my child? Do you finally see something others have been seeing for some time now? Do you see the ideology and indoctrination after your child returns home from school every day? Do you see? Yes, you do see the harm and the confusion they are causing. Do you see the role they are playing on your child's life and development? Do you see? Yes, you see now. And now you have questions. At Unmasking the Trans Movement, we're here to help answer those tough questions you can't ask anyone else, or answers that are hard to find. We discuss the many topics of this evil agenda indoctrinating our children into a world of self-destructive deviance, constant medical care, and human degradation. Our webinars provide access to supporting groups discussing the tough issues you want to talk about with real parents and experts alike. Sign up and become a member now and you'll save 30% off your first-time membership starting at just $7. Select from our bronze, silver, and gold packages, all with different options depending on your needs. Our mission is clear: to unmask the deception and protect the most vulnerable among us, women and children. For webinar dates, times, and pricing, please visit our website at unmaskingthetransmovement.com/webinars.
Welcome back. Jon K is standing by. Let's bring Jon in right now. Jon, we've got a heck of a show today. Transgender politics versus brain science. It sounds like a game show, but I got to tell you, after the last few days in the United States in Nashville, Tennessee, I don't think there's no game to play here. This is being taken very seriously.
That's right, Brad. We wish we didn't have to add that latter portion. This is deadly serious.
Absolutely.
It's already serious because children are being harmed, young people are being manipulated and exploited. And so we were planning on doing this, but all the more applicable and timely now. And I'm so thankful that Dr. Ann Gillies is with us, my capable co-host, and we have an eminent professional, Dr. Michelle Cretella, who is the past president of the American College of Pediatrics. And she's going to do a deep dive with us. We're going to move quickly, dealing with the issue of brain science, because what we saw, what we all have seen, a young woman that targets a church, goes into a church and exhibits the worst of male pattern violence. We all want to know what has gotten into these young people, number one, because of the ideology, but now they're pumping them full of hormones. And Dr. Ann Gillies, I know you were as horrified as I was. So introduce our fine guest.
I'm pleased to do that. Good to have you, Dr. Cretella. You're back again to talk with us. I'm really pleased about that. After Monday's event and the mass murder at the school, I think all of us have been absolutely, horrified, but stirred up at a different level. I think we're all feeling the angst of it because we've been saying for a long time that there's something very, very wrong with pumping hormones into children or adolescents or young adults, and that there's going to be repercussions. And certainly that seems to be what we saw on Monday, extreme repercussions. And then, the other thing that's happening is a march on Washington up to the Supreme Court this weekend. Actually, they're starting there today. And I have a lot of concerns about that because we've been reading reports about cross-sex individuals, cross-sex identified individuals who are being militia trained and have this kind of agenda of retribution and violence. And so that's very, very concerning. So do you want to talk a little bit to start about your thoughts on the shooting on Monday, and then you've got a video that you're going to show us and a PowerPoint presentation. So stay tuned with us, folks, because this is actually going to be a longer presentation. It's going to be a full hour, but please stay with us. Dr. Cretella.
Sure. Let's, we initially were going to talk about true brain science versus the political science that transgender activists put forward. And I think it's really important to try and unpack a bit of the tragedy that took place in Nashville. I'm going to try and share my screen here because I do have one slide in particular that would pertain to this discussion. If I can just slideshow.
And Dr. Cretella, this is so timely because prior to recording, we were talking about the dangers of what is being unleashed on these young people, what these hormones and the amounts these hormones are doing to the brains, to the young people. And you have a slide that you're going to show us about all this.
Yes. Are you okay? So I am sharing. I'm not quite sure why I cannot get it to take up my entire.
It's okay. It looks just fine.
It looks just fine as is. Okay.
Absolutely.
I was able to enlarge it previously, but here's my concern. My grave concern with the Nashville shooting is that every death was a tragedy, including the shooters. What we are witnessing with the medicalization of transgender belief in young people, we are allowing big medicine and big pharma to exploit emotionally troubled youth and to put them on such toxic, dangerous hormones that wreak havoc psychologically, emotionally, and physically. I mean, physically, the most grievous thing that these puberty blockers and cross-sex hormones do to young people is permanent sterilization. I mean, I'm starting to make the argument that this is actually eugenics. We're attacking big medicine, and big pharma is targeting a class of emotionally troubled youth. We have at least 3 studies now to indicate that the vast majority of young people in our current day and age, the vast majority who come to identify as trans, have on average 5 traumas in their childhood and or severe mental illness present before they ever express or exhibit any sign of gender dysphoria or cross-sex behavior. So Audrey Hale, who renamed herself Aiden, has already been acknowledged to have been under the care for a mental illness, in addition to having a transgender identification. She was a highly, highly vulnerable individual who, on top of it, very likely was also on testosterone. And this slide that I have up for you, they say a picture's worth 1,000 words. Children and young adults who believe they are non-binary or trans, when they are female, are put on 10 to 14 times the normal level of testosterone for a female. And what this chart is showing, it was created by my endocrinologist colleague, Dr. Michael Laidlaw. The small blue bar represents the normal level or normal amount of testosterone for an adult female. The gray bar represents a very common disorder known as polycystic ovary syndrome. Polycystic ovary syndrome is associated with hirsutism or body hair, increased body hair, acne, irregular periods, as well as aggression and depression. So you can see the gray bar represents the excess testosterone with polycystic ovary syndrome.
So, and when you, Dr. Cretella, so
Yes,
is that when the body itself is producing too much?
that's correct. That is a common disorder, a common endocrine disorder found, diagnosed among teen girls, young adult women.
And the blue bar, the blue
bar is what the normal. The blue bar is normal. So every female has a normal amount, a small, very small amount of testosterone
that her body is producing. Her body is naturally producing this.
Correct. If a woman has an endocrine tumor, a cancerous tumor that produces testosterone, that may produce anywhere along the red bar. If a woman believes, or a girl, so a young girl, anywhere from ages 8 on up, girl or woman believes that, oh, I'm trapped in the wrong body, I want to transition. She gets put on a level of testosterone that is as high as a cancerous tumor. So this just puts it in context. This is what we are doing to emotionally troubled girls and women who are physically healthy prior to big pharma making gobs of money off of them.
This is like treating them like lab rats.
Oh, worse. Yeah, it's worse than lab rats. So this one, and I didn't do the research myself, and I haven't. I need to double check it, but one of my colleagues has started combing through various search engines looking at mass shootings. Mass shootings, virtually all of them, are typically carried out by men who grew up in fatherless homes. And I think so far we've identified this Nashville shooter. She's perhaps the second woman. But what's very interesting, so my colleague found 2 other reports in the last 10 years. And the 2 other reports, one was another female who identified as trans, and the other, my colleague isn't certain, it was another trans identified individual, but she's still trying to track down, was it a male who identified as female? So given what we know, testosterone, exogenous, this synthetic testosterone does to, it'll drive, excess testosterone in a man will drive him to anger, aggression, violence. So to give hefty doses of testosterone to a woman who's already struggling with mental illness, issues of wanting to harm self, etc., that is going to increase both her suicidality and her homicidal impulses, and give her more physical strength as well to carry it out. So this is criminal on so many levels, and big medicine, big pharma, and our government and big tech are all complicit. This is a tragedy that never should have happened.
Very good. So would it be fair to say, Dr. Cretella, that no competent professional, especially in the medical field, that no competent professional would ever think about doing this to a minor, let alone an adult, but a minor?
Competent and ethical. No ethical professional. No ethical. This is the entire transgender claim is so ludicrous on its face. We shouldn't even have to take it seriously, and it's ludicrous. Everyone knows there are boys and there are girls. There are men or there are women. Sex is about reproduction. That's like a basic biology 101. I don't care if you're talking about, you can be talking about plants. There are male plants, there are female plants. They have to reproduce. The male, whether you're talking plants or animals, the male is that organism of the species that donates genetic material during the reproductive act. The female, whether you're talking plant or animal, is that organism structured in a way to receive genetic material during the reproductive act. So we all know, everybody knows the truth. It comes down to ethics. Are you going to harm someone for money? Are you going to harm someone rather than be canceled? Yeah, it comes down to ethics.
So, Dr. Cretella, this past, I guess it was last week, Dr. Susan Bradley made a very powerful statement. She said, we were wrong. And Dr. Bradley, many years ago, almost 40 years ago, I guess now, would have been one of the ones who started the gender clinic in Toronto. And so now she is saying we were wrong. We were wrong about puberty blockers. She isn't talking so much about hormone therapy, but we're wrong about puberty blockers. And one leads directly to the other if the child starts puberty blockers young. And on this chart, you were saying 8-year-olds. Now, to me, I want to. This makes me really irate.
Yes, because here in the United States, it's like a Wild West. There, we have Joanna Kennedy Olson. I believe she is with LH. I think she's with LA Children's Hospital. We could Google her, but Joanna Olson Kennedy, J-O-K, Joanna Olson Kennedy is a pediatrician who specialized in adolescent medicine and became, she ended up getting married to a woman who is a trans man. And that individual is a psychologist. The two of them together are two of the foremost promoters of medicalizing children. And Joanna Olson Kennedy got the NIH to accept that, yes, children as young as 8 may be put on puberty blockers and cross-sex hormones together. Yes, it could be separately, it could be together. You know, we can't be too concerned about ages. It should go by Tanner staging. All of this is baloney. The bottom line is an 8-year-old child does not have mature, in very rare cases, the vast majority of 8-year-old children do not have mature ovaries if they're girls or mature testicles if they're boys. And you put them on a puberty blocker at that time, you are freezing them down before they have mature reproductive cells. And whether you put them on the cross-sex hormones together at that time or add the cross-sex hormones a few years later, you are permanently sterilizing them. So they're these are very I'm just going to say it. These are very deranged and or evil adults in medicine who are doing this. They are absolutely not.
They're Nazi-like. They are Nazi-like.
Yeah, we can do this, so let's do it.
Well, and then you have these children on the puberty blockers starting at 8. This is it used to be that they started them, 11, 12, bad enough, and now 8 years old, and then hormone therapy. But so you have the effects on the body, which cancel out any kind of sexual pleasure, enjoyment, or the ability to reproduce. And then you have the effect on the brain, which we haven't talked about very much, but these children are not developing the intricate
We're robbing them.
biological things that happen when they go through puberty. Their brain,
it is their birthright. Puberty and adolescence is a critical developmental period, critical from a physical, social, emotional, cognitive, psychological, and dare I say spiritual point of view from all of those areas.
And we're annihilated.
And from the beginning, when these expert scientists in white coats are going, puberty blockers are reversible 100%. It just shows that nobody is critically thinking. I immediately said, that's not true. You cannot, there's no such thing as a time machine. You cannot give that child back the normal developmental time you've stolen from them.
That's right. Yeah.
And that I don't care if it's 2 days on a puberty blocker, 2 months, 2 years. I don't care if a kid stops it at 2 days, 2 months, 2 years. They have been damaged by the fact that you have stolen time that they could have had in normal development. And we know from studies in the past that the vast majority of those kids who were naturally confused about their gender and sex, the vast majority of those kids would desist from they would come to actually embrace their bodies before puberty or after completing natural puberty. By the time they were young adults, 98% of gender confused boys were embracing their bodies, and 88% of gender confused girls were embracing their bodies. That was with or without counseling. So what we are presently engaged in is evil, and it's an evil that is being foisted on a class of vulnerable, emotionally troubled youth. And worst case scenario is suicide and homicide. That's what we saw. It's death. It's death. Lies lead to death.
Yes.
There you go. For a moment, Dr. Cretella, would you talk to us about those medical professionals that make up WPATH? Speak to parents about WPATH. We have to cover this because that, in my estimation, is a grand scheme. They are, talk about foisting harm. So speak right now as a pediatrician, the former president of the American College of Pediatrics.
So I have to correct you. I'm sorry. So it's the American College of Pediatricians.
Pediatricians. I'm sorry.
Yep, American College of Pediatricians. Sorry. And I served 4 years each as their vice president, and then I was hired as their first executive director. So that's okay.
I'm glad you qualified.
Many years as a top researcher with them.
Okay, there you go.
In any case, but WPATH, the World Professional Association for Transgender Health, started out as the Harry Benjamin Society.
And tell people who Harry Benjamin was.
I should know that.
No, that's okay.
He was affiliated with Kinsey.
Yeah, there you go, and connected to John Money. There's close association. To Kinsey and
John Money. So in the 50s, in the late 50s, John Money was a psychologist who wanted to justify his experimental surgeries and hormone treatments of transsexual men. So John Money is the first person to misuse the word gender in the gender never appeared in the medical literature until John Money pulled a new definition out of the air. He said to justify his crude experiments, mutilating experiments on men, he said gender is the internal sexed identity of a person. And people can be born with an internal sex identity that differs from the sex of their body. He completely made that up, no science whatsoever, but he and other sexologists, Harry Benjamin among them, were the first to misuse the word gender and actually inject it into the medical and psychological literature.
And that's why I think it's so important that we.
So WPATH, so basically it's an activist association. And there's a very important paper, which I can shoot over. I'll shoot the citation to you after the fact so you can post it on your website. The British Medical Journal, within the last year or so, analyzed, they pulled all the citations. They did a complete literature review on the so-called science of WPATH. And on a scale of 1 to 6, with 6 being high level evidence-based science, they rated WPATH a 0. WPATH, as I said, they portray themselves as a scientific organization, but is actually an activist organization. Yet they are responsible for the so-called standards of care for transgender patients. And they are now up to the 8th edition. Standards of Care, 8th edition, SOC 8 for short. The British Journal of Medicine reviewed their so-called standards of care, did a complete evaluation of the world literature, world scientific literature on transgender health, and rated WPATH and their standards of care number 8 a 0 as far as scientific evidence.
Well,
the endocrine, I gotta tell you one more.
No,
the Endocrine Society, which is in the US, and that is a professional organization of physicians in the US who specialize in disorders of the hormones, right? Endocrinologists, Endocrine Society. They endorsed the WPATH guidelines in their own analysis. So they too were evaluated by the same British authors, and they were rated a 1 out of 6 because they did a little better job indicating that their so-called standards were based on weak evidence. So people who identify as trans have every right to be angry, but they are angry at the wrong people. They should be angry at mainstream medicine, mainstream pharma, and mainstream psych, because they are being sold a bill of goods for the almighty dollar, and they are being physically mutilated, sterilized, and emotionally destroyed. Whether child, adolescent, or adult, those are the facts for those who actually bother to investigate, do a review of the world literature.
Dr. Cretella, that's what we're all about. We're unmasking this grand deception. It is unbelievable. If people aren't fired up over this, because now kids are being harmed, they're being scarred mentally, emotionally, psychologically, physically, and now we have a young woman who probably was on cross-sex hormones. I mean, if she wasn't, now
Probably
we have the pure
testosterone.
effects of ideology. Either way, it's bad, but it's
either way. At a minute, we know she had mental illness. It's even with mental illness, it is incredibly unusual for a female who's mentally ill to conduct a mass shooting. So I would personally, I'd be shocked if she were not jacked up on testosterone at the same time. This is horrific. It's horrific.
Dr. Gillies, you were.
Yes, well, I wanted just to go back to WPATH for a moment and what you said about standards of care, Dr. Cretella, because they aren't really standards of care.
No, they're not.
They are just suggestions of practice, but those suggestions of practice have now become universal standards, so to speak, and that's what's spoken out to the masses by psychologists, psychiatrists, medical doctors. So they are suggestions of practice to affirm this whole affirming cross
to affirm
ideology.
To affirm. So I do want to back up though, because happily it's not so universal as it once was. We have had the UK shut down they had a single gender clinic for youth that they shut down after now a review of the evidence, which was triggered.
That's Tavistock. That's Tavistock. There we
Correct.
Go. That's right.
Yes. So we have the UK, we have Sweden, Finland, and Norway. Those four have drastically done an about face on allowing transition for youth. It's still full steam ahead for adults, but when it comes to youth, those four, the UK, Sweden, Norway, what was the other one I said?
Finland.
Thank you, Finland. Yes. Sweden, Norway, Finland, and the UK. Those four have said intense psychotherapy, an intense psychological evaluation of the individual youth and their families, and intensive psychotherapy needs to be pursued because the vast majority of these youth, as I said before, have traumas in their childhood and or severe mental illness, which is not being addressed. And it is the traumas in the childhood, the severe untreated mental illness, that is triggering both the suicidal ideation and the gender dysphoria or the trans belief, with a lot of help from the internet and all the propaganda, right? You're basically dealing with a class of emotionally troubled youth who are being told, oh, everything, all the badness in your life, it's because you're trapped in the wrong body. Here, we will affirm you. We'll be your new glitter family. Everything's rosy on this side of the rainbow. Without the internet, we would still have this class of emotionally troubled youth, but we would not have the 5,000% increase in kids and young adults presenting for body mutilation. So that's the real crime.
Dr. Cretella, there's so much for us to talk about. We were going to analyze video of brain science. Maybe if you're okay, we'll have you back.
We should go. Yeah. How about if I
well, what we'll do is let's focus on your PowerPoint right now. We'll go as far as we can go. If you're okay coming back, maybe in a moment or two, because what we were going to look at. So I'll just have you speak to that. There's a lot of videos out there that say that there's a transgender brain. What say you?
Absolutely not. Here. So on the video that you asked me to comment on, these two young adults, first of all, I have to mention this because the first thing they say is, oh, it's so hard and terrible. You know, it's so hard to be a transgender person in today's culture. Who would ever choose that? Clearly, see, it's not a choice. So I want to point out that is a logical fallacy. And this is because our young people are not taught how to think anymore. You know, they're not taught critical thinking. It is the fallacy of the excluded middle. Here's why.
Dr. Cretella, do you want to stop sharing your screen just for a moment? We'll bring up all of us just so we can see all of us large, and then we'll go into the PowerPoint, because I really want people to absorb what you're saying right now.
So sure. So people will allege it is so difficult to live openly as a trans person. I won't, and I'm not going to debate that. I'll give you that. I will say, fine. I will say, yes. Okay, I'll buy that. So who in their right mind would choose to be trans? Clearly, they're born that way. Stop. Here's what you said. Here's what's implied. Our feelings and behaviors are often difficult. Our feelings and behaviors are either 100% chosen, or else our feelings and behaviors are 100% inborn. There's another option that you are excluding. What if it's a combination of things? What if our behavior and our feelings are actually learned, influenced by our relationships, our experiences, whether or not we're traumatized, whether or not we're affirmed as a loved son or daughter? What if our biological substrate is impacted by the environment? What if it's environment, biology, and free will choices we make? Well, that in fact is the true answer that has been backed up by decades of science in behavioral psychology and behavioral genetics. Okay, so the logical fallacy of who would choose that? It must be inborn is the fallacy of the excluded middle. The truth exposed by science is that all behavior, urges, feelings, yes, we're all made of DNA. So yeah, our DNA contributes something to our behavior, but our DNA does not determine behavior. So the devil doesn't make us do it. I'm a devout Christian. I don't believe the devil makes us do it. Okay? Because he doesn't. Our genes also do not make us do it. It is a combination of environment, free will choices, and our personality traits, which are heavily biologically influenced. Okay? It's a combination of things. So that is the first huge mistake they open with. And then they point out, I was surprised, I think they only quoted 1 or 2 studies. I've come across only a handful of brain studies in the literature, which claim to show that people who identify as transgender have brains that are more similar to people of the sex they identify with. So what's interesting about this handful of studies, however, is that they're all very small and not one of them corroborates the other. So in good science, if I have 5 studies investigating the same hypothesis, if those 5 studies are of high quality and with a large enough population of subjects, I would hope that at least, I would hope to have those 5 studies corroborate one another to find the same difference. That is not what happens. That's not, in fact, not one corroborates the other. They all claim to identify a different difference. And they're all very small studies. And they're all only snapshots of adults. So, in fact, they prove nothing. But I will give the opponents, I'll say, let's pretend they're good studies. Let's pretend they're good studies. And that's where I would bring up my slides to take the viewers through this logical thinking now and scientific thinking.
Actually, Dr. Cretella, if you want to bring them back up now.
Sure. And we're gonna, let's see. All right. Can you all see, again, I apologize. I don't know why.
It's okay. I think it's fine. So let's just proceed. Right. You're good. You're good.
Oh, wait, from current slide. How's that? better?
We can still see the thumbnails, but what that means is people have to come back when you come back, and they're going to have to get the rest of it. There's a lot. Yeah, we're fine. Honestly, you're
okay.
good.
So the politics of brain studies, right? So how many of you in the audience have heard about the anorexic who has the brain of an obese person trapped in her head? Right? I know, Dr. Gillies, Jon, have you heard about the obese brains being trapped in the, heads of anorexics? I don't think so.
I haven't seen
it. But guess what? There are many, many replicated brain studies of young women and also some young men who have anorexia nervosa. And lo and behold, their brains look different from the brains of people who do not have anorexia nervosa. They must be they're born anorexic. No, they're not born anorexic, right? Mm-mm. And no, they don't have obese brains trapped in anorexic bodies. Yet, this is the kind of illogical reasoning transgender activists expect us to swallow. So the transgender brain studies, there are far fewer, they are lesser quality, and they don't replicate each other. Yet they claim that there's a girl brain trapped in the boy body, or a boy brain trapped in a girl body. Alternatively, there's one study that came out and said, oh my goodness, we don't see any differences between people with trans identification and people without trans identification. You know what we see? Everybody's got a mosaic brain. That study was completely debunked. So what is going on? All right. In this slide, I take you through the genetics to demonstrate why no baby's born with the wrong brain. And then we'll get into the facts of where these apparent differences may be coming from. So from fertilization, every cell with a nucleus has the same sex determining genes located in the sex chromosomes. So therefore, from fertilization, that embryo is male or female. Male brain tissue and every brain cell has a nucleus. So if at fertilization, it's XY chromosomes, those XY chromosomes and their sex determining genes are in every single brain cell and every single body cell of that embryo, which grows to become known as a fetus and then a newborn infant. They are genetically different, and they are also microscopically, even physiologically different as the child gets older in the womb and outside the womb. All right. In the case of a male embryo, once the male embryo gets to 8 weeks gestation, is a fetus, the testicles have formed and they start to produce testosterone. A female fetus does not have testicles. She does not produce testosterone. Well, she does not produce the levels of testosterone that a male fetus produces. The male fetus at that stage is having every cell in his body, every brain cell in his body bathed in testosterone. Not so for the female fetus. So when these babies are born, they are born with, the male fetus has a male brain. The baby female fetus has a female brain. Barring I'm not talking about exceptions like, the mother was exposed to testosterone. Even in that case, let's say the mother of a girl baby was exposed to testosterone. That may cause some masculinizing features, like the phenotype, the external features may change, it does not change the baby girl's DNA. Her sex does not change, and it is not going to predetermine her thoughts or feelings.
Dr. Cretella, I'm aware of the clock. This is unbelievable. We've had to, in my estimation, we needed to set the groundwork for what you are going to share. Would you be willing to come back? I know you've mentioned you would be willing to and are going to plan on doing a webinar for us where you're going to be able to spend intensive time methodically working through this.
That might be the ideal. Yeah. I can say just quite simply to wrap up this topic quickly would be the brain is like a muscle. The more you exercise one area of the brain, that area of the brain will change. It's called neuroplasticity. And you are absolutely right. To do this topic justice, I would have to come back. But suffice it to say, the transgender activists are playing politics. They are not preaching authentic brain science.
And I'm the one that directed us into, because we needed to, right? How much information do we need to cover? We have to. So it certainly lets people know that Dr. Cretella has an entire presentation. We're going to be doing a webinar. We're actually going to have Dr. Cretella be our first webinar. And people need to know, parents need to, and lawmakers, people need to know, Dr. Cretella, what you know, what you're going to be sharing, but how invaluable is it that you came on the program again and spoke to the issue, because we have that young gal that went in, it became a shooter. And as you disclosed how much testosterone that this young gal was probably on, and it's because of this ideology and those unethical medical practitioners, or those that are supposedly doctors, that they're harming these kids, and now they're placing society at risk.
Mm-hmm.
And it's just shocking. And we have so much. We had an entire video. We'll have you back. We're going to walk through that video that you referenced, just so people can really get the feel of the propaganda that is being pushed.
Yes. That'll be excellent.
Right. And Dr. Gillies, I'm in the U.S. You and Brad and Dr. Cretella, we're from the U.S., but you and Brad, you're from Canada, and the science has been ignored, and people now are dying because of what is happening. And you and I spoke to what was happening in Canada. So I'm so appreciative that you're here. You've written a book. You're a trauma professional, and I'm just very appreciative that you're here. And I'll let you then hand it over to Brad. So have the last word, Doctor.
Well, yes, I don't need the last word, but I am excited, Dr. Cretella, that you're going to be addressing neurobiology, because this is such an important topic when we consider these young children. Even if they are not going to be put on puberty blockers and hormones, their brains are already being redirected neurologically. Neural pathways, new neural pathways are forming in their brains through the educational system. And the things that they are being taught, it's all part of this bigger agenda, I'll call it an agenda, to sexualize the children, and also then to confuse them and to push them then into this whole idea that they could be cross-sex identifiers. And so while trauma has typically been the biggest, I would say, push into some other kinds of sexual experimentation or orientation or identification, what we're seeing now is there is still trauma, but there's also this high level of actual suggestion that's changing the neural pathways in the brain. So I am so excited you're going to be talking about that.
Dr.
Well,
Cretella.
thank you. Oh, there you go.
Go ahead, John.
Brad.
Okay, Dr. Cretella, I wanted to, as the director producer guy, I've got a quick question myself today. And, you know, one of the things that crossed my mind as you were going through all of this was something simple and easy. Is there hope?
Okay.
Is there hope?
So, all right. I'm gonna. The only way to answer that, hope is a theological virtue. I believe in God. Without God, there is no hope, because without God, that would mean we have to rely on human beings.
These children's minds
But
have been changed already. They're being
they have
continually
been
daily
changed.
for 8
That's right.
hours a day, and I need to know whether there's hope for
Yes.
these kids and bringing them back from what they've already been indoctrinated in.
So, from the science, from the neuroscience, yes, there is hope. Precisely because the brain is a muscle. Just as with our physical muscles, we can work out, we can build them up, and if we stop good exercise, we get flabby, we get unhealthy, but we can get back on track. The brain is the same way. If we help these children detox from the toxic internet binges and actually get them into healthful, truly healthful psychotherapy, meditating on the good, the beautiful, get them affirming themselves as virtuous people. And that's when I get parents who say, "Oh my gosh, my daughter just came out as trans. What can I do?" Embrace her. I love you. You are our child. You are not alone. We're going to take things slowly and go through this with you. But our rule is we're not going to help you do anything harmful to your body. Let's take it slow. We love you, and affirm her character. Has she been courageous in the past? Is she creative? Affirm those good character traits. Try and help the daughter or the troubled son see the good in themselves. It's all about trying to shape their identity away from all those, to pull them away from the toxic garbage they're getting, typically online or on their phones.
You know where there's a great place to do exactly that, Dr. Cretella, is right here on Unmasking the Trans Movement.
All right, there you go.
That's exactly what we're here for, is to help. Number one priority for us is that. So with that, we are out of time today. I want to thank you very much for being here, and we look forward to the webinar coming up. People will have a chance to get signed up in advance for that. We'll get the word out as soon as we get that date booked with you. And obviously, we know what the topic is going to be. Dr. Ann, thank you very much for being here today as well. And John, as always, it's a pleasure. We want people to check out our BitChute channel. That's something that's important. We have all of our episodes there at go to bitchute.com, type in Unmasking the Trans Movement, and you'll find us quite quickly. Something else that is interesting as we go forward, not only webinars, survivor support group meetings, detransitioning support groups, where it's not necessarily the help that we're able to give is going to be educational, and I want to make sure that we understand that first and foremost. It's educational for parents, educational for grandparents, and educational for kids. That's what we're all about here at Unmasking the Trans Movement. Till then, well, next time. We'll see you soon. I'm Brad Wilder. On behalf of Jon Uhler, Dr. Ann Gillies, and Michelle Cretella, remember, it's not your kids' fight. It's our fight. We'll see you next time.